Good afternoon. We're being told we can take our masks off in public and hug again, so things are maybe even normalizing, which means the evening barbecue or the weekend party with friends, including hamburgers and hot dogs on the grill, may actually be something that creeps back into your activities and social life, but it's going to be a change in diet, perhaps. Even though it was what you used to do, it may be a change in diet that your GI tract is going to look at you and say, we haven't done this in a while. Are you really sure you want to go back to this? And so I'm approaching this topic with a little bit of trepidation, as you can see, because most of us have been yearning for this return to our normalcy, and it's coming for summer, which is even better because it's going to allow us to resume all of the crazy days of summer activities that we would do, which usually meant cramming lots of things into a short period of time because summers in Wisconsin are short, so we put as much in as we can. But when you haven't been doing certain activities or certain foods and you suddenly overdo them, it may have consequences. So partly you may have some issues with your GI tract talking to you and saying, I know I used to like this, but I'm not so sure I like it right now. And I may not like it at the pace you're doing it because once a week may be okay, but maybe 3 times a week is a little much when you haven't done it at all. So what I'm really going to talk about today is kind of part 3, if you will, of our leaky gut discussion that we've been having. And is this really something that you brought upon yourself, or is this still a leaky gut kind of syndrome that's just an extension of doing food you're not used to and your GI tract doesn't like a lot of grains or a lot of man-made carbohydrates? But really, is it potentially something else? Is it really stomach versus is it small intestine versus is it large intestine? And all of that has slightly different symptomatologies that you're going to run into. So if it's your stomach is actually going to give you a lot of acid or reflux, or you may actually have such intense burning pain right at the base of your esophagus that you can't tell if it's in your stomach or in your lungs, and it may cause your heart to race. So it may be a lot of acid or a lot of foods that you're not used to eating, and your stomach therefore puts a lot of acid out to break down something you're not used to seeing. And one of the biggest reasons for that happening is the old American staple, the hamburger. If you haven't been used to having a lot of hamburger meat, or steak is another one, you haven't had a lot of steak, now you're going to grill out. You've been thinking about that grill out of that steak all week. You're going to have that steak because it just sounds wonderful. It's that return to our normal weekend routine in a summer. And all of a sudden, what you're faced with is this intense stomach pain. You're doubled over, and now you're wondering what can you do to get rid of the pain.